Hello, everyone. Thank you for taking time to join our webinar for plastic surgery in Tijuana with Mexico Cosmetic Center. I am joining you from our office in Sacramento, California, and I'm expecting Dr. Peter Lopez to join us shortly from Mexico. And we get this our webinar going. This has been a popular webinar for information about plastic surgery with us. And of course, the medical tourism part of it, which is traveling to Tijuana and getting high quality services. Again, I appreciate everyone to take time to join us today. We have a special offer if you attend this webinar and watch the webinar to the end, and I would release a Zoom poll at one time before we go to Q&A at the end of the webinar. You are qualified to get up to $1,000 off from your surgery package, or you can select to get exosomes treatment free of charge preoperatively. Of course, we would talk about exosomes. Stem cells and exosomes are hot subjects right now. Exosomes are a huge way to increase your body performance and your cells performance. We will go over the stem cell and the exosomes in detail in a little while. Again, appreciate everyone joining us. Hello to all of you. I am in Sacramento, California, in Folsom, from our main office here. And we try to cover as many questions as we think the attendees have and during the presentation. So if you didn't hear the questions that you may have answered, please feel free to put it in the Q&A tab, and we will get to it at the end. We'll try to cover as many questions as we can, but sometimes, there's not enough time. And of course, you can circle back with your coordinators or call us and ask questions. Just little words about me. My name is Ron Ellie. I am the founder and CEO of Mexico Bariatric Center, which is our flagship for bariatric and weight loss surgery, and Cosmetic Center, which is plastic and cosmetics in Tijuana, Mexico. My wife is actually directing this program. Flora, you will meet her shortly. She's been with the company since the beginning, of course, and she knows in and out of this, how to qualify patients, what's the best thing for patients. And we have a team of coordinators that are working with you on a daily basis. Tiffany is our long-term. She's been with us for a few years. She's our past patient herself. And we have Andrea and Bianca. And we are hiring new coordinators so we can handle the best way for your needs. Hospital Azar was a project that I started in 2021, end of 21, and it finished in 24. Has been a game changer, has made us to be a full circle transformation and full service hospital for all your needs, not just weight loss surgery, for plastics, cosmetics. I mentioned about stem cell, which is a huge game changer. We do all sort of gynecology, including hysterectomy, endometriosis, hip, knee replacement, any type of joint surgery, and more. Um, we have neurologists now, we have urologists, we have all sort of expertise now in the hospital, and we're working with the best of the best surgeons, medical doctors, medical staff, scientists for stem cell. Of course, we work with a bunch of scientists in Mexico. Mexico has been in the leading edge of stem cell in the world and has one of the best labs right now that we get to work with their scientists, with their medical doctors, and support our patients. The topics basically our presentation is going to educate you about the different type of plastics, especially post-bariatric surgery, post-bariatric plastic surgery. We would try to educate you as much as we can, and then we would show you why you should choose MCC, Mexico Cosmetic Center, and what is it that we offer that is unique. There's so many things that we offer that is unique, and we will cover all that. So I did mention about Hospital Azar, which is our new hospital that has been a game changer. We'll talk about what's the patient process. How do we get you in? How do we make sure you get the best procedures for your case? Remember, every case is different. Everybody is different. Everybody has different needs, right? If you trying to um, look like you were in when you were 20 or 30 years old, that's one thing. Sometimes is the purpose is more like skin removal. You lost massive amount of weight and you need to lose the skin. So there's so many things for face, for your body, and we will talk about that. Dr. Peter Lopez, which hasn't joined me yet, is going to be with us and talk about all these different procedures and educate us. We talk about our packages, what really includes. We talk about stem cell packages, and I would release the Zoom poll like I mentioned. That's required for you to take advantage of uh, the offer that I mentioned at the beginning. If some people joined a little later, so you, by attending this webinar, you have a chance to get up to $1,000 off of your surgery, depends on what packages you select. And, or you can select our exosomes therapy, which is 3 billion IV treatment with exosomes. We will talk about that later. We have, I was mentioning about what we have right now in our hospital is access to the best of the best in any kind of medical services, and one is plastics. Dr. Peter Lopez is actually one of our experienced surgeons, and we do have Dr. Daniela. We do have Dr. Navarro and Dr. Guerrero, and we do have these surgeons do certain type of surgery. Each surgeon is expert in certain type of patient, certain type of areas. Like some are good in body contouring, some are good with face. So we know which surgeon fits you best. And you know, you hardly find a surgeon that is good with face and body and can do everything the best. They say they will do, but they're not the best at it. So that's why we come into picture. We find what's the best option for you specifically. I was mentioning about NBC, Mexico Bariatric Center. We are a flagship for bariatric surgery worldwide. In Mexico and worldwide, we're number one with the type of procedures we offer, with the variety, and being in the leading edge of this industry. We have all type of procedures from gastric sleeve to bypass to mini bypass, new procedures like intestinal bipartition, SASI, of course, classical SATI and DS. We do endoscopic, laparoscopic, any type of revisions. And one thing I would touch base in a while, in few more slides, about the qualification and what you need to expect from plastics and bariatric surgery. Of course, cosmetics, which is a big list, I would, of course, let Dr. Peter go over it. This is just a highlight of the procedures we offer. And I mentioned all the other services we offer, including hysterectomy and gynecology and regenerative medicine, which Dr. Raquel is in charge of. We've been very successful. We could use it preoperatively to help with your faster recovery, less inflammation during the surgery, after surgery, or we could use standalone, which means anything from anti-aging wellness to joint problem, arthritis, shoulder separation, knee, any joint. And then we also use this for Parkinson's disease, diabetes type 1, which would be most likely spinal. And we can do a combination of all the IV and the local injection. And we could do with exosomes and stem cells. Okay, so one misconception or myth is plastic surgery a solution to lose weight? And this is absolutely no. We see this often in some centers across the border, or mostly in the US, that the companies don't care about like what is your BMI or how heavy you are. They want to take your money and give you the plastics, which is not a good solution. We are very strict about how your BMI. BMI is basically a body mass index. It's just a formula that you put in your height and weight, and it gives you a number. We're very strict about that. Some of the surgeons are more strict than the other ones, but in general, we don't want to give you plastic surgery to replace it with weight loss surgery. And to be honest with you, I mean, so many, for example, one or two of our coordinators right now, which is our past patient, came to us asking for plastic. And we said, no, this is not a good solution. They went through MBC, got weight loss surgery, and they came back and did plastics, and they cannot be happier. One of them is Kelly, which I'm going to show you the slide toward the end of my presentation. And if you are a post-bariatric patient, basically the best time to get this procedure to do a skin removal and body contouring or face, it's 1.5 years out. In 1.5 years, you've lost all the weight, almost. You're at your ideal weight, and you don't have to repeat this, right? That's the reason we don't do it for the higher BMI. So medical tourism has opened a lot of doors, especially Tijuana, because it's proximity to US, because of the expertise right now in Tijuana, and you can get discounted packages, and these are all inclusive packages, which means includes the medication, the bandage, the post-op care. You see what the package includes. We don't have just a surgery center to get you in and out, and then you be in charge of all the instructions. You have to read what to do, go to the pharmacy, buy this, pain medication, this medication, that medication is all inclusive. And you get to work with the best of the best. These are the super surgeons that we use to do multiple procedures in one operation. And even CDC offers the recommendation is to go with a company like MCC, Mexico Cosmetic Center. I mentioned about why Tijuana. Tijuana has established itself as this center for bariatrics and plastic surgery in the world. The amount of expertise that we have in Tijuana right now is off the chart. The team of surgeons that I mentioned, these are the best of the best. And believe me, I mean, we are attracting surgeons from the best universities, best colleges, best hospitals in Mexico, which is Guadalajara, Monterrey, Mexico City, of course, Mexico City, and Sinaloa. We get the best of the best coming to us to do these surgeries for you. So you are having the off the chart medical care. One of the factors that we look as a company, there's so many factors we look in, is how many hours you are under anesthetic. So if you look at the literature, you see the side effects and problems with keeping the patient under anesthesia prolonged more than 6 hours. That's one of the factors that we look in. So we fit enough surgeries in one operation, but not to exceed that amount of time. And as you see, these are problems if you're under anesthetic for a long time, right? Your respiratory issues, your it elevates the infection rate problems, blood clot, but also you have to consider that our surgeons are great that they can do multiple procedures in one operation. One thing that you need to consider is social media is a great tool, right? Instagram, TikTok, Facebook, of course. These are places that you see these cute videos, viral videos that shows some influencer that got some surgery somewhere or some normal person that could be real or it could be fake. That's the problem. If it's real, it's great because it's educational. But if it's not real, then you're basically getting scammed. That's why I recommend that you look into the company behind it. Are these just cute videos that some marketing company is putting out? Or is there something behind it? Are these Photoshop before after pictures or they're real? What's the credential of the surgeon? What's the credential of the company? Who's behind the company? Are they trusted? One of the things that MCC, MBC, we offer is we are a US corporation. Remember that. A lot of these companies are in Mexico and they don't have any liability. They do whatever. We are a US corporation. We go by US standards. We regulate the industry actually by having our presence in this industry. And we've been helping patients achieve top quality, get top quality procedures, get their dream body in Mexico at a fraction of what is in available to them in US, Canada, and they get all inclusive packages. So this is how we work. You fill out a health questionnaire online. We do have secure servers. You put your pictures, which are in a short time, I'm going to show you which part of your body, how you give us those pictures. And those pictures are uploaded in a secure server. The only people who have access to this is basically your coordinator and your surgeon. They go over this. Of course, our surgeon liaison too, which is Jen, because we want to make sure medically you're qualified, not just your picture, right? That's why we ask you extensive question about your health. We want to make sure your hemoglobin is up. We want to make sure you don't have any cardio issues. We want to make sure you're clear medically and give you the best option for your body to get the dream body that you want. So do not hesitate to upload the pictures, because these are not being shared with some other third-party companies, or is not going around and having everyone have access to it. It gets uploaded to our secure server. From there, only surgeon has access to it and your coordinator. The second step is, once we get those pictures and we get your health history reviewed, we made a recommendation for you. Hey, you need a circular tummy tuck and you need a breast lift with implant, for example. This is what we call most of our mommy makeover packages. And that's when you'll be given a price code. Of course, every patient is different. It depends how much we have to remove skin. What do we do with that individual? And then at that point, if you decide that this is something you like to do, you put a deposit down and you schedule your surgery. We do have very tight schedule right now. I know most of our surgeons are booked at least through end of August, if not past that. Because we are in high demand, I recommend that you do this faster, so you find a date that matches your availability. And after that, basically, you just fill out the paperwork, you book your flight if you're driving. If you're down in Southern California, of course, you know when to drive, where to show up, how we pick you up, all the hotel, hospital arrangement, and required paperwork. I mentioned about pictures. These pictures are very important. We want to have the best scenario to consult with our surgeon to give you the best option for your surgery. So for face, for example, these are the poses that we want. Pull your hair back, front, sides, like that. And if it's body, I have a short video here. Let's And for body, you don't need to show your neck up. Of course, if you need something done at the on the facial surgery, you could, but it's not necessary. So you just do a neck down. And like I mentioned, if you are a post-bariatric patient, wait 1.5 years out for your weight to stabilize and get the best results. Age, we are limiting it to 70, depends, of course, in each every individual health is different. And basically, one thing we want you to do is make sure your hemoglobin level is high, especially if you're getting multiple procedures like Mommy Makeover. Make sure you do this at least a month out before you come to us, and make sure your hemoglobin level is more than 13. And take iron, of course. Make sure that, again, you maintain that. I was talking about how the process of you submitting a health questionnaire goes. First of all, we have developed complex routines to know which surgeon does what best. So when you submit your health questionnaire, we already know based on your profile, like what is the best surgeon for you. But our surgeon liaison Jen is sitting between every HQ that goes between the patient and the surgeon. Let's say we say Dr. Peter Lopez is the best for body contouring. So with that, HQ goes to them. And then of course, the coordinator is dealing with the patient and going between the surgeon and the patient. And like I mentioned, once you get your price code and you get to see what's best option for you, then you select what date you want and pay the deposit and you move on. So here again, for people who joined later, I see some people joined later. These are the process. This is the QR code to fill out a health questionnaire. By attending this webinar, you get up to a $1,000 off, or you can select to get the exosomes therapy preoperatively, for which is valued at $12.95. This is a huge factor for you to help you recover faster. Your skin will look better and you will get better results. Support is a huge part of this process. Before and after, we have Facebook group that has our past patients. You can join as a patient, and these are real patients, by the way, not just some numbers we're throwing around.
They say it's real. They don't know anything about it. Thinking of September, learning of it, I'll wait for it. It's never too late. 2,000 miles to the
So, yeah, we talk about Hospital Azar and being a game changer. So that's just another video where it's located. Um, I need to take a little break because it looks like Dr. Lopez is trying to join us and he hasn't been able to. Make sure we get him in. Okay. So, I apologize for this. I hope that you can join us shortly. Back to your presentation. The name of the hospital is a tribute to my mother, Azar, and this facility has 4 operating rooms, state of the art. Everything is the best of the best in the hospital. 35,000 square feet of rooms for patients, about 40 beds. We have most of our rooms single bed, and we do have some that are double, but you have to ask ahead of time for those. Um, we have everything in the hospital, including X-ray, uh, lab, including um, fluoroscopy. So you name it, we have it in the hospital. These are not Photoshop pictures, these are real pictures of the hospital. And the companion can stay with the patient. The way it works is you come in the first day, you arrive, you have option to stay in the hospital or hotel. Again, the sooner you book, the more options you have available to you. And then once you arrive the next day, we do the surgery, you stay most of the time 2 nights in the hospital. This is a full service hospital. It's not some surgery center that, we have everything up to the code from the OR, from the recovery areas. We have white areas, gray areas, black areas. We don't mix things up. And the companion can stay with you for those 2 nights in the hospital or can go in the hotel. That's up to you. You select those options. We used Hyatt, which is about 3 blocks away from our hospital. You can actually see uh, the hotel from our hospital or the hospital from our hotel. So patients companion can easily walk is about 3 short blocks. As far as medications, we want you, if you're on Ozempic, please stop 2 to 3 weeks before the surgery. No blood thinners 1 week. These are just general guidelines. No NSAID. And we tell you exactly um, what medication to stop or start if you're taking stuff on a regular basis. And we suggest that you bring any bottle of the medication you're taking on a regular basis. So we want you to arrive before noon and depart after 2 p.m. That gives us enough time to get you in, do the pre-op test, and then after that, we would cross you. Of course, each person stays there, customized. Um, make sure, Dr. Customized number of nights depends on how extensive is your surgery. If you're just doing an arm lift or a breast lift, is different from somebody who's doing mommy makeover, which is bunch of surgeries at one time. So those people stay longer. Usually the maximum is usually like 7 nights, 8 days, and it could be as little as 3 nights, 4 days. Again, we tell you exactly how many nights you're expecting to stay there. We talked about the day you arrive, the day of the surgery, and post-op, we keep you again 1 or 2 nights in the hospital. After that, you have option to stay in the hospital for all the time that you're there. People who do not have companion, maybe that could be a good option. But again, if you book early enough, we have chance to say, yes, we have room for you to stay in the hospital. And but if you do choose to go to the hotel, we have a nurse that comes and help you with bandage, taking shower. So you have that option too. Um, so this is what we call all-inclusive package, which means we keep you enough to recover. Of course, some of the incisions you have to take care for 3 to 6 months out, but you'll be ready to go back home after the time we keep you in Mexico. Make sure Dr. Lopez is joined, I hope. Let me see. I don't see him on. Just give me a moment. Okay, I'm still looking for him. Uh, I will have an introduction when he actually joins us. And I would let him talk about all these different procedures. But for now, let me talk about um, aftercare. Aftercare is huge in the incision recovery. Um, there are tapes, there are scar gels, and those are the best way to take care of your incisions, okay? And you need to um, make sure because surgery is half of the equation. You have to take care of yourself. How you recover is very important, and we keep emphasizing on that. Um, we do have a spa in the hospital. We do lymphatic massage, and we can of course do Botox and all that, fillers, exosomes, and stem cell. There you go. He is. I see him now. There you go. Dr. Peter, do you hear me? You're on mute, by the way, and I don't see your picture.
Okay, can you hear me?
I just don't have your picture. I do
Okay,
see you now. Oh,
okay. Let me check that.
perfect. Thank you. Well, good to see you. How are you doing?
So good. I'm here actually at the hospital. Hello for everyone.
Yes, yes. So I was just doing an introduction for you. And you want to talk about your background, your education, your expertise?
Okay, perfect. Hello for everyone. I'm Dr. Peter. I'm here being practicing plastic surgeon for over 5 years. I'm really excited to let you know about my degrees. I'm a plastic surgeon certified by the Mexican Board of Plastic Aesthetic and Reconstructive Surgeon. Um, my specialty is in mommy makeover, breast augmentation, implants, tummy tuck, BBL, liposuction, and obviously nose job. I have been performed too many surgeries, so I'm here to let you know about my work and about my results. Let's start about the facelift. The facelift is a surgery that can improve the texture and the shiny skin that the patients get about the years. So we perform two kind of facelift: the traditional facelift and the deep plane facelift. Traditional facelift is more focused on the skin, but the deep plane facelift can remove the skin, and also we can trade the deep plane that it's like a barrier that are inside of us and can repair even muscle. So the result is more lasting than a traditional facelift. This kind of facelift is indicated to patients that had post bariatric surgery. So in this In this square, we can see that our main target is to treat the mass layer in the deep plane facelift and also the ES mass facelift. Okay, there are some photos of a patient that had a deep plane facelift. We can see how the jawline can change with this kind of facelift. Also, you can see that all these patients keep the facial structure, but in a younger way. That's the purpose of this facelift, not to change who you are, just to make you younger. So that's the point of this kind of surgery. About the tummy tuck, this is interesting to talk about. Many patient has for liposuction, many patient has for a tummy tuck, but we need to make a difference between these procedures. The liposuction is just for patients that are really thin and patients that don't have a sagging skin. But tummy tuck is indicated always for post-bariatric patients and patients that have pregnancies and also patients that have changes in the skin. I mean, sagging skin. So a tummy tuck can divide it in many types. For example, the mini tummy tuck is a mini scar that we perform in the lower abdomen, but this is just indicated for patients that have a really amount, really small of skin. There are patients that are younger and the patients that are not post-bariatric. About the standard tummy tuck, extended tummy tuck, and circular one, there are for patients that have lose weight, but also they involves the front area. And about the fleur de lis or butterfly tummy tuck, we performed also the horizontal scar, but also we make an incision, a vertical incision. This vertical incision is necessary in that patient that have sagging skin on the back and also in the middle area of the abdomen. With this kind of tummy tuck, we can hold all the tissue that are in your back to the front and give you a better shape. So that's the difference between this tummy tuck. And there is the last tummy tuck that it's called reverse tummy tuck. This is for patients that have the excess of skin just under the breast. It's really weird to do that because too many patients um, have the sagging skin just in the lower area. So that's the point to do tummy tuck to improve the sagging skin, remove them, and also to make plication. We call plication to repair the muscle, the separation of muscle that exists after a huge loss of weight, and also that patient that have pregnancy, they also get that separation of the muscle. And here we are. Here we can see two patients that have a tummy tuck. The first one gets a extended tummy tuck. Like I said before, the purpose of that tummy tuck is to remove the excess and the sagging skin. We can see the changes, the before and the after with that kind of procedure. This patient have the right side, they have a fleur de lis tummy tuck. Why? Because if you see the vertical and central area have a huge amount of fat and skin, but also in the horizontal area. So that's why this patient is candidate to a fleur de lis. The next patient has a tummy tuck plus a breast implant plus a breast lift. This is called a mommy makeover. That it's a combined procedure. We're gonna talk about this procedure in the next pages. Okay, about the healing of a tummy tuck, what to expect? The scar take an average 6 to 8 weeks to heal and about 12 months to fade. So we need to be patient. We need to understand that the healing process can be slow for maybe a few patients, could be faster with other patients. Everybody is different. So on average, it can take 6 or 8 weeks to have this to improve the inflammation. About this, we can improve the healing process with some things like the silicone tapes, creams for a scar for 12 weeks. We can protect him from the sun, use sunscreen. This is really important because if you don't use sunscreen, you can get a spot in the scars. We can avoid activity. The activity that we're gonna avoid is maybe the exercise like spinning, like weight training. We're gonna avoid that at least for 6 or 8 weeks. And also, it's important to stay hydrated and get healthy after the surgery because many patients think that after the surgery they can get the food, fast food for example, or they have to eat too much, all food of groups. Remember, you are in a healing process. You need to be really really conscientious what are you are healing. So it's important to have good levels of hemoglobin, good levels of protein. So we're gonna need to eat really, really well. About the breast augmentation plus breast lift, um, we have to know that the implant's gonna improve the upper pole of our breast. Sorry, I lost the assignment. Okay. It's important to know that there is many incisions of a breast. There are a lollipop, a anchor, also a periareolar or it's called dome, and a crescent incision. It's important to know the kind of breast that you have because we decide what kind of incision you're gonna get after your surgery. For example, many patients are candidate, younger patient, for a breast lift with just a periareolar incision, but other patients are candidate with a inverted T. So the difference are really important to know, but we just need to analyze to see your photos in order to decide what kind of breast lift you're gonna need it. We can also add to a breast lift or a breast augmentation a liposuction in some areas like the axillary areas in order to improve the shape and the contour on the upper area. We can see a patient that have a ptosis. Ptosis is called when the breasts are not in a good position. This is a post-bariatric patient. We made a breast lift plus a place implants, so we can see how it looks natural, how it looks beautiful. So it's necessary to combine implants with the breast lift in order to get that kind of results. The arm lifts are an important procedure that we perform in patients with weight loss because we need to remove the fat, but also the skin that maybe bother you. So we perform three kind of arm lift. The first one it's called the mini arm lift. The second one, the standard, and the last, the extended. What's the difference between them? Well, the length of the incision. For example, the mini arm lift is just in the proximal area. The proximal area is the axillary area. Maybe could be an incision of 10 centimeters. Is really small, but this is just for the patient that they don't have sagging skin in maybe in the elbow or maybe in the middle area of the arm. The standard arm lift is for patients that have sagging skin and fat in the axillary area, but also in the elbow area. And the extended arm lift as patients that have the excess of skin after the elbow. This is really this is not too common to do the extended, but if necessary, we're gonna perform that kind of procedure. Here we have the same patient actually. This patient was maybe 3 months ago. We operate this patient and we can see the changes of the contour of the arm. And also, this patient likes to training. She start training, try to exercise, and we can see how it looks so beautiful, the contour of her arms. So it's a really nice procedure to do, but obviously remember that it's important to take care of you to keep that results like this patient. The tight lift, it's a many bariatric patient, especially after gastric sleeve or bypass, often opt for this procedure. Sometimes combine them with body lift and abdominoplasty. Remember that we can combine many procedures in one time, but remember that it's necessary to prioritize the procedures or the area that you want to improve. Maybe a thigh lift and an arm lift can you can combine together. We can combine the thigh lift with a tummy tuck or thigh lift with a breath lift because this is a large scar that we perform because the area is big. So we need to make sure that you are in the conditions to have this kind of procedure. About the thigh lift, you can improve the contour of your legs, mainly in the inguinal area. So we can perform a regular thigh lift that is like the arm lift is the area that it's really near to the inguinal area. The extended thigh lift is near to the knee, and the spiral thigh lift is incision, a larger incision uh, that goes after the knee. So we need to evaluate in order to decide what kind of time you're gonna have. About the mommy makeover, it's a combined procedure that combines a tummy tuck. Also, we can perform a breast surgery, and also we can combine an arm lift, a thigh lift, or a liposuction. The mommy makeover takes an average three procedures that that you can combine. But what is necessary to have a mommy makeover? First, you need to have a good level of hemoglobin. What it means a good level of hemoglobin? Upper than 13 your level of hemoglobin to have this kind of procedure. For example, if you want just a tummy tuck, maybe we can perform your surgery with the hemoglobin that it's in the 11 points. But if you want a mommy makeover, it's necessary to have 13 or up than this number. About this indicate for patients that look for improve the contour of their body. For example, if you want to improve the abdomen area, but also your breast, we can perform abdominal makeover. Also, we can add a surgery in your arms in order to improve that three areas. So it's a combined procedure that is really important to have in mind that you need to plan really, really well because you need to rest. Also, you need to have a good recovery. So it's gonna take an average 2 weeks to recover after this procedure. And maybe the full resume activities could be after 1 month. This is a patient that have a mommy makeover actually. We perform a breast lift, we place implants, and also liposuction and a tummy tuck. So this patient is really happy. We can see the results 3 months after her surgery. It looks so natural and she looks amazing. She is happy actually. This is a younger patient that lose weight. So we perform a circular tummy tuck plus a liposuction. So she gets a natural shape, looks amazing. In the other side, we can see a patient that have a tummy tuck. She was skinny actually, but she wants to get her muscle repair. So we have to perform a standard tummy tuck. Actually, this is a standard tummy tuck plus a breast augmentation. The Brazilian butt lift is an extra procedure. It's not the main procedure. Why I explain that? Because if you want a BBL, we need to perform a liposuction, but you need to be a good candidate to have a liposuction. Remember that liposuction needs to be combined with a tummy tuck in patients that lose weight or there are post-bariatric patients. Why? Because if we perform just liposuction, you're going to get more sagging skin. So we need to remove the sagging skin and also we can make the liposuction in order to extract the fat that it's in the flaps. So that fat we use in the hips or in the butt. So that's why I explained that the Brazilian butt lift is a extra procedure that we can add in your surgery. Here we have a patient that wants to improve the contour of her hips and also the contour of the gluteal area. So we perform a BBL, but you can see that we made a cut. That means that she gets a circular tummy tuck plus a liposuction. Okay, remember the BBL needs to be combined with a liposuction, but plus a cut. That means a tummy tuck. This is a this is a treatment that can help you with the aftercare. So here at the hospital, we can provide that. Obviously, I know that you can ask for them.
Yeah, I was mentioning how important the
Mhm.
scar, you know, maintaining the scar after surgery is even 3 months, 6 months out. And the better job they do, the more, successful they're going to be. If you talk about, please talk about a lot of patients, when can I lift weight? You kind of mentioned it, but like, different activities basically post-op surgery. When can they go back to
Okay,
walking,
perfect.
lifting.
Yeah, it's important to know that the walk it's really mandatory after your surgery. You need to walk at least 5 minutes. I also recommended my patient after her surgery, the day after her surgery or their surgeries, they need to walk, just walk in order to prevent thrombosis. But it's two different to walk for exercise and to walk for prevent a thrombosis. For exercise, that means that you need to walk at 30 minutes. You can start walking after 2 weeks. Okay? About a sitting office and that kind of procedure, there are different timing for the surgeries. For example, the rhinoplastic, a breast augmentation, and an arm lift, you can wait 2 weeks to start your activity. But with a facelift, a tummy tuck, a liposuction, and a thigh lift, you need to wait 3 weeks. So why? Because the first procedures are smaller than the second one. So that's the reason. For example, if you are a patient that really likes to exercise, you can get the full regimen exercise after 2 months. So that's the point about that.
Yeah, this is same. Yeah.
See, it's the same. Uh-huh.
Yeah, thank you so much for explaining. I'm gonna cover a bunch of more things about what our packages include. Basically, we don't charge you like um, diamond nickel you basically. It's all inclusive, which means the surgeon fee, the anesthesiologist fee, the hotel fee, depends of course how many nights you stay before, after, the hospital fees, all the pre-op, post-op tests, medications, nurse visit in the hotel, nutrition support, transportation, surgeon liaison. We even give you garment if it's one, of course, it's included if you need it for your body contouring. By the way, I did release the Zoom poll. Please go ahead and answer it. Um, we do have a hyperbaric chamber. That's another huge benefit of better recovery. I recommend we do offer hyperbaric chambers at atmospheric pressure of 2. Anything below 2 is not going to be as effective. So you need to go to atmospheric pressure 2, and that's what we offer hyperbaric chamber for you. You can get few sessions that helps with your skin, especially for circular tummy tuck, fleur de lis, and we offer medical tourism insurance. Okay. Medical tourism insurance, I will cover MTI in a little bit. That's a huge plus by going with our company because you get a huge discount and it covers you up to 90 days after the procedure. Basically, coming to us would save you over 50% at least. For example, for deep plane facelift in US is normally, we're just talking about mini facelift. We're not talking about full facelift, which includes the eyelid, everything, the forehead, stem cell grafting, all that. It will cost you north of 50,000. Depends on where you are. There are surgeons in San Diego that they charge over $100,000, and they don't even put you in a hospital. They are not even bringing an anesthesiologist, so you're kind of like awake, and they cannot do too many procedures when they don't put you under anesthetic. So that's something you have to remember. That's why we could do these huge mommy makeover procedures. We can do a fleur de lis circular plus a breast lift under 6 hours. So these are huge benefits of going with our company. So but in general, our facelift is fraction of what you will pay in US, and we are better because, to be honest with you, all the facelift Look, Dr. Peter was sharing with you the difference between the conventional facelift, which you only pull the skin, S mask, and a deep plane facelift. Deep plane facelift is a new technology, is a new technique, is a new procedure that not every surgeon can do. And in US, you don't find very many. They call them vertical, they call them whatever they call them, but they charge you a lot of money. We can do this better than them at a fraction of time, fraction of price. And this is all inclusive, which means you don't have to worry about nothing. You get taken care of after surgery until you heal and you go back home. So why choose MCC? Because of all that I'm mentioning, right? The years in the business, the surgeons, the care that you get in a full service certified hospital, the packages we offer. There is a difference between assistant surgeon and an experienced surgeon. Remember, a lot of these people that come in and they do surgery and they do these cute TikTok, Instagram videos, there are new surgeons. So what you need is an experienced surgeon. Like you would not give your life to a pilot that has only 200 hours of flight time versus a pilot that has been flying for 10 years and has 10,000 hours of flight time. We don't use assistant surgeons. We use experienced surgeons with the experienced team that work with them and support them. This is huge. Okay, now about MTI. MTI is a unique medical tourism coverage that offers coverage for you up to, we just increased that to 90 days after surgery, 3 months after surgery. From the day you travel to the 90 days after bariatric plastic surgery, you will have this coverage for $249. That's a deal that you cannot get for $700 or more if you were to buy it yourself. And we don't get a penny of this. We just have this relationship that we can offer this discounted service. As far as how to pay us, there are several ways you can pay us. Zelle, of course, credit card. If you need financing, most of the patients pay the deposit and then they send us the cashier check picture a month ahead. And then we know that's how they're going to pay and they take it with them down there. But you can borrow against your 401k. You can, if you have a good relationship with your credit union bank, you can ask them for a loan. But if you don't, we have really great options right now with Klarna and Afterpay and PayPal that you can do this at a very, very affordable rate. Just ask your coordinator to send you a link. It takes 5 minutes to qualify, and they will tell you right away how much you qualify for the surgery. I mentioned about ExoSims. This is the package that you get free of charge if you attend this webinar. This is combination with stem cell. It's going to speed up your recovery. We call them stellar stem cell, which helps you with inflammation, tissue regeneration, faster recovery, and basically it's a game changer since we had this regenerative medicine. We do orthopedic surgery like knee replacement, hip replacement, all that. Okay, so I think we are done. I did mention about plastic and bariatric. Kelly is an example. She actually works in MBC with patient who wants weight loss surgery. She is a individual that came to us years ago looking for plastic to lose weight. We told her, no, you need to go get bariatrics first and get plastic. Because we offer a wide range of services, for us, it doesn't matter which company you go to, we want you to get the best option for you. She went and got bariatrics. She lost weight. She came back and did a mommy makeover. She cannot be happier. She says, I feel like I'm back in 30 years old, and she feels great. She looks great. And this is what we do for patients. We call them full circle transformation. Okay. Um, as far as of course, we have so many other success stories that we did a full circle transformation. These are patients who did the bariatric and plastic with us, and they look great. Um, Joanne is on our website most of the time. You see her face. Um, Jen is another one. We did a bariatric and plastic on her. Um, So you can see us on social media and TikTok. I'm going to start answering the questions. Dr. Peter, are you still around so we can go over the questions?
Hello, Ruth. I'm here.
Okay,
I'm
okay.
here.
So I'm going to read the questions to you. I
Yeah.
mentioned about Ozempic, which is, of course, Zepbound, Mounjaro, Wegovy, all that, right? We mentioned that it's best for them. Well, not best. They need to stop taking those GLPs about 2 weeks pr prior to the surgery. Now, there, Philip is asking, how about when can I resume the Zepbound? If I'm stopping 2 weeks before, when can I start taking them again?
Okay. We recommend you always to our patient to avoid this medication 3 weeks before the surgery. The ideal timing it have to be 1 month. Okay, so why we try to avoid that? Because this kind of medication can affect you in the anesthesia process. So if you have problems in the anesthesia, we can perform your surgery. So please, the recommendation is 1 month. We can tolerate 3 weeks. Okay.
And how many weeks do they wait after the surgery to resume it?
Okay, after the surgery, we don't recommend you to continue if the purpose to use this medication is to lose weight because you're gonna get more sagging skin and it's not the best for you. Okay, if you get a cosmetic surgery and the purpose of use this kind of medication is to lose weight, we can start using after your surgery. Okay.
So there is no limitation. They can start
Yeah.
taking it right after.
Yeah.
Okay, thank you. So Kelly is asking, are we going home with drains or the drains are removed prior to flying back home?
Okay. The drains, we remove the drains after 10 days, but many patients don't want to wait 10 days here in Tijuana. So if you don't want to wait that time, you're gonna go to home with the drains and a medical staff or nursing can remove them. It's not necessary to be a plastic surgeon to remove that because it's a process that is really easy to remove. Don't be worried about that. And it's necessary to have the drains because you're gonna waste too much volume after your surgery. So we can remove maybe in 5 days, in 7 days, because you're gonna get open wounds because the liquid wants to go outside.
Chris is asking that he is a male and he's 3 years post bariatric surgery, and he's saying if I get a circular tummy tuck, is it possible to get the upper groin area skin removal and the chest skin um, at the same time?
Okay, perfect. Like I told before, it's necessary to have good level of hemoglobin. We can perform maybe three procedures like you ask. but it's important to have good level of hemoglobin. If you don't have a good level of hemoglobin, it can be possible to perform the circular tummy tuck, the chest, and also the groin area. So we need to make sure that you have a good level of hemoglobin. So something that is really important in post-bariatric patient, it's gonna take 2 or 3 stage to maybe get all full body the full body better. So you have to keep in mind that. And also maybe if we perform for example chest surgery, maybe you're gonna need another one, or maybe the next. So it's necessary to keep in mind that. So the answer is have to a good level of hemoglobin, have good levels of protein, to have at least 3 procedures in your first stage.
Cute. How long is the hotel stay after tummy tuck, and does a nurse come to the hotel? So basically, I was mentioning that every patient has a customized package, how many nights they stay. Usually, again, the first night you arrive, we keep you in the hospital for mommy makeover, tummy tuck, usually 1 or 2 nights, mostly 2 nights. So that's 3 nights, and then maybe another, what, 3 nights after, Dr. Peter, for tummy tuck alone?
Yeah, I always recommend you to at least be here in the hospital, but also if you want at the hotel. But about the days, well, it's a answer that you can have maybe 5 days at least here, or 7 ideally.
Okay, so we answered that. Oh, do we need passport? Yes, I highly recommend you bring passport when you coming out of Mexico. Most of the time, you're fine, but you just find that one officer that once in a while you run into that can give you a hard time. So I highly recommend passport card or passport book. Um, yes, if you need a note for staying out from your job 2 weeks, whatever, we do the FMLA work for you. That's included in the package. So just approach your coordinator, and they put you in contact with our administration, and they will do the paperwork so you can show it to your work and provide accommodation for post-op. Yeah, the questionnaire, basically, you can find the health questionnaire on Mexico Cosmetic Center .com/, I'm just typing in health dash questionnaire. Okay, so that's the link. What kind of pain management do you offer, doctor, post-op surgery?
Okay, the surgery that we can, the pain manage that we use always are muscle relaxes. Okay, they are called like that because after the surgery your muscle have too many tension. So this medication can act over the muscle, so it's called like that, like relaxer muscles.
Sorry for the delay. Short thigh lift, it doesn't. Release arm lift with ancillary liposuction. Yeah. So can you talk about liposuction when you do tummy tuck or arm lift or thigh lift?
Okay, about the liposuction, we perform a 360 liposuction that it's all around your abdomen. But for
Um,
example, if there is an area that you want to focus, for example, the arms or the thighs, we can perform that. But remember that you have to be a good candidate to have a liposuction, because if you don't have a good quality of of the skin, we're gonna need a arm lift and also a thigh lift. A thing that many patient has is if I get an arm lift, um, I'm gonna get a liposuction in that area too? Yes, the answer is yes, because arm lift, it's a combined procedure. For example, we need to first perform the liposuction, and after that, we remove the sagging skin. It's the same to the thigh lift. We first perform the liposuction, and after that, we remove the excess of the skin. So it's a combined procedure.
Um, Also, Don is asking, I'm looking for the arm lift and I'm looking for a thigh lift that the scar ends in the groin, and arm lift that scar is in the armpit.
Okay. Yeah. Well, we need to evaluate your case, because you need to be a patient that needs that kind of incision. So this is a personalized evaluate.
Yeah, that's why we ask for pictures, right? We
Yeah,
ask for
actually.
pictures and it's case by case. Everyone is different. Be- And that's actually, I kind of went over that. So the process is you submit your health questionnaire, which we get your health history plus the pictures. The pictures gets uploaded to a safe, secure server. It gets shared with the surgeon. The surgeon evaluates it and make recommendation. The better picture you send, the more accurate recommendation we make. Now, but the final plan for the surgery is when you actually down in Tijuana. And that's when the doctor actually marks you. That's when you decide to finalize what was recommended on the initial consultation. Okay. Now, in a short time, I'm gonna have Flora come in, and she's the one actually working with the coordinators day in, day out, with the doctors, with Jen. So these are the people who are involved making sure you get the best surgery for you. And another question that Dawn is asking is, do you offer neck lift?
Yes, actually, we talk about the neck lift, about the traditional neck lift, about the deep plane facelift. So, the neck lift is a surgery that needs also an incision in this area in order to trade this sagging skin under the neck. So we can trade that. We can combine with a facelift, or we can just do the neck lift. But again, we need to see your picture, because if necessary to perform the neck lift and also the neck lift, well, we're gonna recommend you that, because it's not good to do just the neck lift and not trade the face area if you are candidate to do that.
Uh, they're asking Tanya is asking about deep plane facelift. This DPFL is becoming very like common. Can you talk about, well, you did talk about facelift. You did talk about conventional, all that. Can you talk about deep plane facelift one more time?
Yeah, the deep plane facelift, it relies deep retaining ligaments and reposition the ES muscle layer. So we can also trade the fat part and has a single unit. So it's gonna improve the deep area of your face. So the results gonna be less than a traditional. The traditional, remember that just straight the skin.
Thank you. Now, Christina is asking that she just had hernia repair, and her hemoglobin is at 11. Christina, we need to know what type of surgery you're doing.
Yeah.
And also, when we saying, the more procedures you have in one operation, the higher the hemoglobin needs to be. Now, if you're not, then the option is basically possibility of blood transfusion, right? So you have to know that. So, but it's just your choice to do what you have to do before you come to us, or come to us at that hemoglobin, and then during the surgery, if you bleed too much or you need, we just do a blood transfusion. Tell them that costs money. Yeah. Um, so um, So Kayla is asking, I'll be 69 soon, because I did mention about the age, we're trying to limit the age to 70, but again, each patient is different, right? We all age differently. A patient at 70 could be in great shape, with cardio, everything else, and that's why we analyze your health questionnaire. So can you get a facelift and mommy makeover? I think it depends on your health situation, right? Dr. Peter, do you have anything to add to that?
Yeah, it's necessary to evaluate her health situation because it's important to know about all of this because first, Mommy Makeover can combine with a facelift. The patient can combine that kind of procedures together. They can be together because it's there are different areas. So the time also it's too large for a mommy makeover and too large for a facelift. So we can perform and combine a mommy makeover with a facelift in the patient with the age could be 40, could be 18. We can combine that procedures. Okay, so keep in mind that. So we need to analyze your health status.
So this patient is I was approved for circular fleur-de-lis breast lift with implant and arm lift, but I was told that I have to do the arm lift separately or the breast lift at a different time. I'm more insecure about my arms. How would be the best? Do the arms separately or the breast lift?
Okay, remember that this is your decision. First, is your body. You decide what is the main area to train. So remember, again, the hemoglobin is important. If you have a circular fleur de lis, you can add just one procedure. So if the area that you want to treat, we can add just the arm lift, and the breast lift can be in the second stage. But remember, it's important to have good level of hemoglobin to have this combined procedure because just the circular tummy tuck plus fleur de lis are a huge procedure.
Okay, Sarah is asking, how do I schedule? Very simple. Once you submit your health questionnaire, we will get back to you by recommendation of what's best for your situation based on what you're asking to get done. At that time, you just basically put the deposit down, and we find the place on our calendar to fit your schedule and fit the surgeon's schedule. Like I mentioned, we're booked, and it's very hard to get near dates, but we can try. And but anyway, the sooner you act, the better. And so basically, all it takes for you to send us your health information and your pictures. After that, we will guide you through every step. Um, if they have a nipple pierce rings, on the breast augmentation, can you put uh, piercings back after the surgery?
Okay, this is an important question. You're gonna need to wait after you have a good healing process, after you are recovery, complete recovery. That means that you can start using that 2 or 3 months after your surgery, not immediately.
Um, Again, they're asking about neck lift. Basically, when we do a mini facelift, right? The mini facelift is usually this area and the jawline, right? And when you ask for neck lift, and the facelift usually goes together. You can combine different pieces of facelift. Of course, if you need the eyebrows to be included or not, these are just, but usually we do offer full facelift, which means it will cover everything on the forehead, everything down here, but sometimes you may not need it. So it's a case by case. You just have to ask the recommendation from the surgeon once you submit your pictures. Um, um, Especially now, since the doctors in the US don't have issues with removing the drains. Do they have? I don't think there's an issue with removing the drain. And like you said, you don't have to have a doctor do it, right? Can the patient remove the drains themselves? Yes. We lost Dr. Peter for a minute.
Okay, what was the question? Sorry.
Um, no, I forgot. Honestly, I forgot what I asked.
About the drinks, I just hear
Oh, yeah,
that.
yeah, yeah, about the drains. Can the patient remove their own drains?
No, this is no. It's impossible that the patient can remove that adrenaline. It have to be a doctor or a nursing staff.
Um, do you give RBCs if HBG is low? Also, will you do hernia repair and hysterectomy with the tummy tuck procedure?
No, no, it can be it can combine atomic with this procedure because the hernia and the history needs to open the fascia, and we don't treat inside the fascia. We just straight over the fascia because the surgery repaired the fascia actually, but it needs to be closed. So it's not, it can be that combination.
Yeah, we do like sometimes we do combo surgeries like sleeve and hysterectomy and combine bunch of those. Best if you do this separately, like you mentioned about possibility of having infection. I know you guys want to do most that you can in one operation, but sometimes you have to consider the side effects and complication rate. Now, so sometimes we can do tummy tuck, breast lift, and arm lift at the same procedure. Depends on how much skin we have to remove. And but more it's best if you do like especially arm lift and leg lift separately because the recovery is hard. So if you can do the tummy tuck and arm lift in one surgery and come back to the leg lift in another surgery. Yeah, you should be able to do the hemoglobin test just by primary care physician giving you a test request, and it's a very simple blood test. Yeah, we call mini facelift. Yes. Well, okay, so Dr. Peter, can you talk about different type of liposuctions, and if any of them actually tightens the skin too?
Okay, this is the last question. But about the liposuction, about this, there are too many kind of liposuction because it's gonna depends of the area that we're gonna treat. For example, the 360 liposuction, it's all around your abdomen. For example, if you are interested in your arms, in your thighs, we can perform in that areas. Also, we can perform in the axillary areas in order to improve this area too. So it's gonna depends of the area that you really want to improve. But like I said before, it's gonna depends of the quality and the texture of your skin. Remember that if you are a post-bariatric patient and you just want the liposuction like a single procedure, you are not able to have that kind of procedure alone because you're gonna get more sagging skin and it's gonna look no good for you. So that the difference. We can use also retraction technologies, but again, you need to be a good patient, and we need to combine with procedures that need to be removed and cut.
Um, so okay, about rewatching this presentation. Yes, we it would take us a few days. We will post it. Actually, you should get an email saying thank you for attending and send you the link to rewatch this if you want to. But it will be on the YouTube or on our MCC channel. I see like 30 more uh, open questions. So um, a lot of questions about hemoglobin. Guys, it's not a big deal, especially if you're post-bariatric patient. You need to make sure your hemoglobin is high enough to come do the surgery. And then again, if it's not and you couldn't get it up, basically we have to make sure you're open to get blood transfusion when you're down there. Yes, we do Botox. Um, yes, we do. So the pain medication depends on your pain level. Usually, you don't need a very high dosage of, you know, strong pain medication. I again, they're asking for lap band removal before tummy tuck. When you do tummy tuck, again, we can offer a lot of combo surgeries, but I don't recommend that. You need to come and do this one at a time for your own safety. Okay, so thank you so much, Dr. Peter, for joining us today, taking time to answer questions. I appreciate every one of you guys to join us. Again, if you didn't hear your question answered, we're more than happy to do that. We have coordinators in our office that work from pretty much 8 a.m. Pacific Standard Time to 5. And you can reach us from text, email, phone calls, and hope to see you down in Mexico in Hospital Azar. Thank you so much, and we see you next time. Goodbye.